Ehlers-Danlos Syndrome has, thus far, been a bit of a puzzle in the medical community. It is classified as a rare disease, so most providers see it as being insignificant. This causes society to take the position of, why should we put so much time and money and resources into something that affects so few people? This lack of awareness and education is causing so many people to suffer in silence. But I'm really hoping that we can begin to change that. It has come to light in recent years that Ehlers-Danlos Syndrome is not nearly as rare as once thought, as it affects hundreds of thousands of people worldwide in a very real and sometimes very debilitating way. I'm Dr. Derik Anderson. I am Clinic Director of the Muscle and Joint Clinic in San Rafael, California. I'm a member of the International Consortium of the Ehlers-Danlos Society, a founding member of the Fascia Research Society, and an EDS research grant recipient. A majority of my patients have Ehlers-Danlos Syndrome. I have been researching and treating EDS for years. I've received enough calls from the emergency room saying, "We have an EDS patient here. We've loaded them up with narcotics and they're still in pain. What do we do?" To know that this really needs to be talked about. EDS is a genetic connective tissue disorder that causes the body to produce faulty collagen. Collagen is used for almost every system in the body. The main symptoms are widespread pain, joint hypermobility, and fatigue. Ehlers-Danlos Syndrome has a multitude of comorbidities, the most common of which are mast cell activation syndrome, POTS, thyroid problems, and gastroparesis, each of which can be totally debilitating on their own. There is a wide range of severity of EDS. Some people seemingly are very functional, having jobs, going about their day-to-day lives, yet they actually are in a lot of pain and suffer from things like subluxations, where other people are bedridden and wheelchair bound and out of sight of society for most of their lives. The most important thing we can do right now to help as many people as possible, as fast as possible, is to spread the word. Even just arming people with a more thorough understanding of how EDS works and what to look for is huge. EDS affects the entire body. So the key to treating Ehlers-Danlos Syndrome is to back up and look at the big picture, to treat the person as a whole, instead of bouncing from specialist to specialist, trying to treat each individual symptom separately. To effectively address Ehlers-Danlos Syndrome, we need to treat a person's chemical, physical, and emotional imbalances. Patients spend so much time suffering and being pushed aside by providers who just don't have the information that they need to diagnose or treat them. Because EDS was only classified 25 years ago and is considered so rare, there's almost no training given to doctors, especially those who went to school 10 or 20 years ago. It gets misdiagnosed all the time as fibromyalgia, chronic fatigue syndrome, or psychosomatic disorders. So the chances are that the numbers are much higher than are being currently reported. But I just treat EDS. The best people to tell you what it's like to really have it are the patients themselves.
My journey to getting diagnosed was a long one. I did swing dance for about 13 years. And then once my EDS progressed to a point where I could no longer do that, I unfortunately had to give up on swing dancing, which was my life passion. I did it competitively, absolutely loved it. Dancing was everything for me. When I finally got diagnosed, it was like all of the pent-up frustration and anger I had towards previous doctors that didn't understand it and, just kind of sent me back and forth. I actually broke down crying the first time I spoke with Derik because he made me feel so seen and so understood. That's something I had never felt from a doctor before. People weren't looking at me like I was crazy. Someone actually understood the pain and the suffering that I had endured. And it was really nice.
I struggled as a young kid with stomach problems, random growing pains, and even in middle school, doctors would turn me away, saying there's nothing wrong with me. EDS affects my everyday life, from being able to complete homework to be able to get out of bed every single day is a struggle. One thing that I wish that doctors did know about EDS is that pain is a spectrum. and just because you've gone to med school and you are a professional doesn't mean that you're a mind reader.
I was definitely born with EDS, but nobody at the time knew it. I'm 74 years old, and nobody put all the clues together until I was 72. So I'm grateful to that doctor. It might have been helpful to know that I don't have many physical problems. I just have many manifestations of the main problem. I don't know how many doctors actually are trained in diagnosing EDS. I wish more doctors were. Perhaps I would have known sooner. And I guess I would wish that doctors would understand the pain, which for me has increased over time. Now I've talked to a physical therapist and I've talked to other doctors and I said, oh, EDS. So where were they then?
My journey to getting diagnosed was a pretty long one. I'm from the Caribbean, so we're known for a lot of things, and medical stuff is not one of them. I was diagnosed a lot of different times with a lot of different things and had to get a bunch of unnecessary treatment, unnecessary surgeries, recovered from them incorrectly. Then I found Dr. Anderson and I came here for the first time as a specific EDS sort of clinic, and it's helped me tremendously. So I've been just to every single type of doctor there is because I didn't know what I was dealing with, and I think a lot of doctors, just given their past success and their, like, I guess, authoritative status and their ability to say what they want, people can sort of listen just because they're the one with the credentials, right? They're the one to believe. A lot of the times, EDS is very hard to explain, especially when you are younger. So they tend to jump to conclusions quite a lot. If you figure out the right way to incorporate the proper steps into your daily routine, I think it's something that you can 100% get around. And you can, I wasn't able to play soccer for 5 years, and now I'm back playing scrimmages with my friends twice a week. I go to the gym 5-6 times a week. I'm able to do everything that all my people of my age are able to do, and just because I put in a little bit of more effort, and if you stay consistent with it, it's something you can definitely get around. So don't get discouraged, I guess. That's the main point.
Between the time she was 10 and 18, there were a lot of odd things going on with her medically that couldn't be explained. A lot of odd things going on with my younger daughter that couldn't be explained. I happened to meet someone at a CRPS clinic, and he suggested the diagnosis of EDS for my girls. So I went to some specialists all on the West Coast, and with the diagnosis of EDS, and everyone kept telling me, no, they don't have it, no, they don't have it. I went to the East Coast, found a specialist, and he said, yep, they've definitely got it. I knew there was something wrong, but I just couldn't find anyone that could say, yes, this is it, emphatically, this is what it is. It controls your life, really, because so many systems go wrong because of EDS. And if you try to go to a doctor that doesn't know anything about EDS, they can actually end up making you feel worse. We have to go to the emergency room because my daughter's shoulder is out of socket. The doctors there are looking to see a shoulder that is completely forward and completely out of its socket, not just partially. If it's been out for 3 weeks and my daughter's in horrible pain, they look at her and they have no idea what's going on, and they say, well, it isn't all the way forward, you're fine, you can go home. And that's not the way it works with EDS. They always sort of give me that, oh yeah, I know what it is, it's not a big problem, you know, your joints are bendy. What's been most helpful to me and my daughters through this journey has been the ability to work with someone who understands EDS. Just like the doctors that don't really know about EDS, no matter how much I read about EDS, I don't understand it to the detail that he does, so he's just been an incredible resource.
Being a parent of a child with EDS is challenging because you want to think it's mild and you don't want it to get worse. And she did her little tricks with her elbows backwards, and she did all kinds of fun stuff. She hiked, but you could see it as a mom, it was getting worse. Growing up, you just, the pain, her ribs dislocating, her knee popping out. She couldn't get braces because the orthodontist was afraid that with her EDS, her jaw would pop out because her jaw would dislocate. Yeah, as a parent, you feel helpless, especially when they're on the ground in pain and you can't help them. You want to be able to just do anything you can to make her feel better and let her dance again or hike again. So you find little ways of doing it. That first visit with Dr. Anderson was like, oh my gosh, she's gonna be okay. He's gonna help her slowly. It's gonna take a while, but he's gonna help her. There's actually somebody that gets it. I wish more doctors would understand the detail, the depth of what EDS is, because Dr. Anderson, wow, made so much of this, like her eating habits and what she takes in actually can hurt her joints. And we just didn't know that. We didn't know any of that. And so he has been a lifesaver, literally. So her demeanor has changed from giving up to looking forward to getting better.
I was in practice for 21 years before I decided to focus on EDS. As healthcare providers, what we really want to do is help people. And what it took for me was one patient coming to me saying, Dr. Derik, I just got diagnosed with this illness, this crazy syndrome. And that's all it took for me. I fell down this rabbit hole, I researched, and I really sought out treatments that would be effective for my patients. And here I am years later, having found a path to help people with EDS. Thank you so much for watching today. Please subscribe for more videos on EDS and follow us on social media. Our links are in the description. I really hope that you learned something. And again, I thank you for watching. See you again next time.